Well, for me, it was seeing multiple patients coming in frequently, had a history of using multiple ophthalmic medications to treat their glaucoma, complaining of itchy, burny eyes, or patients that were referred to me for rule-out blepharitis when they were on multiple medications. The science has very clearly shown that topical glaucoma medications are directly correlated with ocular surface disease.
SLT really rounds out our anterior segment practice. We have a predominantly cataract refractive cornea practice that does some glaucoma, and SLT brings a nice option for those patients, especially seeking a lifestyle type procedure that allows less drops and less fuss to control their disease.
We had no choice. A lot of our patients have had glaucoma now for several years. I actually inherited a 40-year-old ophthalmology practice. We have a lot of glaucoma patients, and they're seeking other options in treating their pressures.
Well, I think that for the patient, the benefit is obvious, that not only do they save the money at the pharmacy with their monthly medications, but their eyes are more comfortable because they don't have to use it. We don't have to worry about compliance with our patients. All the studies have shown no patient's 100% compliant. So we can sleep a little better at night knowing that the intraocular pressure is better controlled. And from word of mouth, it's been very helpful because patients will tell their friends that they're no longer needing to use their medication anymore because they've had this laser procedure, and that brings more patients into the facility.
The benefits are obvious. Better pressure control. Better pressure control means lesser drops, better compliance, and better outcomes in treating glaucoma.
The benefits to the practice and the patients are both easy. From the physician standpoint, you know that they got the treatment that you wanted them to get, and you don't have to wonder if the patient is doing their part for taking the drops. I find that patients are intimidated by drops, and we know from compliance studies that patients often don't take their drops the right way. If my day's going too good, I ask a patient to show me their drops and how they're using them, and all of a sudden you see them going down the side of their face or using their artificial tears instead of their glaucoma, and it really eliminates a lot of those concerns.
Well, for me, my favorite is obviously primary therapy, but I've used it to get patients off of medication. I've used it as patients need an additional medication in lieu of putting them on a second drop, as well as as rescue therapy as a last-ditch effort to save them glaucoma surgery.
I use SLT at every stage in the game, depending on the initial patient. Every initial patient that comes to me, I offer them the choice of a prostaglandin versus SLT, unless there's some contraindication. Patients oftentimes choose SLT, and that's one of the things that makes it particularly useful in a refractive surgery practice where you have a younger and more active style of patient who wants to avoid drops. That being said, oftentimes eye drops won't get you where you want, and SLT can give you that last bump that you need. Another good place to use it is in an older person whose glaucoma is getting a little worse. They can't do their drops as well as they would like to, and you're trying to avoid one of the more difficult surgeries like a trab or a tube.
I've used SLT now over the last several years as primary, adjunctive, and rescue therapy. In the days of these economies that copays are very high, patients have polypharmacy, they're looking to go from 3 drops to 1 drop. For folks that have been very recalcitrant to modern therapies, pharmacological therapies, I've used SLT in rescuing these patients and achieving better IOPs.
Well, it's allowed me to bring patients off of some of their number of medications, whether from 2 to 1 or 1 to 0, and with combination of multiple other therapies, allow me to rehabilitate the ocular surface and get them to a point where they're much more comfortable than when they first came to see me.
Enhanced outcomes. Patients love it. The fact that you're curtailing their copays, curtailing their total investment towards glaucoma, and providing them the opportunity of having better control with SLT laser.
SLT has really rounded out our practice. It's helped us treat patients the way they want to be treated, whether it's with drops or a minimally invasive laser procedure that can help them avoid taking drops.
The best improvement has just been the decreased frequency of repeat visits of patients who are complaining of the itching, burning eyes. By being able to get them off their medications, or at least one of their medications, they're no longer having that chronic irritation that with the acute exacerbations where they're calling saying, I need to be seen right away again, I can't take this discomfort. And so by saving those what can be very painstakingly long conversations and clinic visits, I'm able to work a lot more effectively now.
Absolutely. The biggest referral for our SLT practice has been patients saying, you know what, Dr. J performed SLT on me or a laser for me. Go and ask him about laser therapy for glaucoma. So we have had an increased throughput. More surgeries, better outcomes.
SLT has definitely added to the surgical options that our patients can choose. And so the ratio of surgery to patient visits probably goes up when you look at SLT. It certainly is easy to incorporate into practice because we're accustomed to doing things like a YAG capsulotomy during the middle of our day, and SLT just fits into that really nicely.
I actually don't market SLT. I think most of the marketing is almost done on its own from word of mouth of the patients. A patient will come in to see me, and if it's a primary diagnosis of glaucoma, I'll give them the option of topical drops versus SLT. And 100% of the patients will say, no, I would rather have the laser procedure. And when they tell their friends about it, if that friend has already been using a drop for a while and has not been aware of the opportunity to get off of that drop, they'll usually come in and see me, and it's really been a tremendous practice builder.
We don't really market SLT in the traditional sense of marketing, but what I do find is that when I'm out talking with our referring doctors, optometrists in particular, they find that they have lots of patients that they've put on eye drops and it doesn't work for them, or they can't tolerate them, or they don't want to pay for them. And by mentioning that we have it, oftentimes they'll send their glaucoma patients in, we'll perform an SLT, and hopefully get them off some of their eye drops.
Well, we market ourselves as good surgeons in the community. We're eye physicians and surgeons, and we don't actually market SLT per se, but we do market ourselves as cornea, cataract, and refractive surgeons that take care of all aspects of comprehensive ophthalmology. And I think SLT fits in that umbrella.
Oh, absolutely. I think it's a very, very safe, minimally invasive procedure that for the patient improves compliance, saves them money, especially in this economic situation we have today, and as well as just as being a practice builder, it's been all around terrific. You know, as refractive surgeons, you and I both know that completing the ocular surface is tantamount to improving visual acuity, and so anything that we can do to improve it is helpful.
I certainly will. In fact, I've done SLT on 6 relatives. So I recommend it for my relatives, my patients, and other surgeons who are comprehensive ophthalmologists that practice all aspects of ophthalmology, including glaucoma, to undertake this new technology.
SLT is an easy product to recommend. It's safe and it's effective, and there's very little downside. It's easy to incorporate into your practice. It doesn't alter patient flow. It contributes to the bottom line, and it gives you something to offer those patients that are adverse to drops for whatever reason.
Well, I think it's a great investment. I think that with the baby boomer generation increasing, and our patient populations are just going to keep going and going, there are going to be more patients than ophthalmologists can handle in a few years. There's going to be more glaucoma than we're going to be able to treat from a surgical standpoint. And if we can address it with a laser that doesn't have too many side effects to it, that's very helpful. I think that for those people that are concerned about the upfront cost, there are many services that offer roll-on, roll-off packages, and that can be just an easy way to get your foot in the door to make sure that you're comfortable for the technology and that it works for you. But I think ultimately, because of the packages that are available, not just with small footprints, but also easy portability, I think it's a very good option for just about any practice.
I think SLT is a wonderful option. Obviously, with any new technology, you are going to have capital inlays. So if you can't purchase your own SLT, you may have it at the surgical center where there's more surgeons using the facility for the SLT.
SLT has been easy to incorporate in our practice in a number of ways, both financially because the return on investment is good, but also in the patient flow. It's an easy technology to implement into your practice and have it start contributing to the bottom line right away.